I have been in practice in Chula Vista, which is in the south area of San Diego, for over 3 years, almost 4 years. And then more recently I have a North County office up in Encinitas, and I've been practicing rheumatology for about 5 years. If I don't have a captive audience there to get their labs drawn at that time, then the likelihood of them getting it done can be maybe 50 to 70% of them will do it. And so up to 50% aren't doing the labs that I'm requesting. And it also does affect their treatment, because when they're there for their appointment and I'm hoping to be able to review their labs, sometimes there's a change that I may or may not make, and it would have been based on what their results showed. And if I don't have those results and they decide to get them done a week later, then somebody has to call the patient to let them know whether or not we're going to make a change to their medications. And so it's just more time wasted. Before the point of care testing was somebody who did have a critical hemoglobin and needed to be called to go to the hospital. And if I had had that available, then the patient wouldn't have had to be called in the middle of the night and told they need to go to the emergency room. Sometimes that can be really difficult. Another thing I forgot to mention, was like language barriers. And so if I'm trying to call somebody who doesn't speak English in the middle of the night and explain a critical lab result to them, that can be a huge problem. And so if I have the point of care testing, I can tell them to go to the hospital right then while they're still in the office, instead of trying to reach them later and have potentially a translator or one of my staff explain it to them. Patients who, during a consultation, I wasn't entirely clear as to what their diagnosis was, and because of the lupus testing primarily, I'm able to make a diagnosis a lot sooner and while they're still in the office, and be able to discuss it with them and discuss treatment with them. And potentially, if it was a severe case, you could avoid a hospitalization. Now that we have the point of care testing and have the real-time lab results, it's nice to know that the patients are going to get their blood drawn, and I feel comfortable refilling their prescriptions at that visit. Whereas sometimes if I'm not sure that somebody's going to actually follow through and they're asking for refills, that can be an issue because I don't feel comfortable trusting them to get it done. Other things that have changed have been, for the anxious patient, getting the results back right away does help them and cuts down on potential phone calls and further conversations that myself and my staff need to have with them down the line. Patients feel guilty when they haven't gotten their results, or when they haven't gotten their laboratory studies done. They like the option of being able to do it when they're already coming to their appointment and not having to do multiple extra things just because they're unlucky enough to have whatever condition that they have. Prior to Genelite, basically we did not contact patients unless there was a lab abnormality or something needed to be followed up on based on the results. So it was kind of, the patient was supposed to assume that their results were normal. They could have access to our portal if they needed to, if they wanted to see the results, but very few people actually utilize that. And so most people didn't get follow-up on their results until their next visit. In those cases, we would sometimes have them follow up sooner than we would have otherwise. And so they're going to have to come in for extra visits that they wouldn't otherwise have needed. I'm not entirely sure why this hasn't been done sooner, because this is the way that lab testing really should be done, is get results back a lot quicker. It's just so much more convenient, and getting the results back is really helpful to everyone.